Today's hot topic is urinary tract infections. These are infections that occur usually from bacterial overgrowth somewhere along the urinary tract, which includes the kidneys up in the back that create urine, ureters that carry that urine down into the bladder, which is in the pelvis, and then the urethra, which actually carries the urine from the bladder to the outside world when you choose to urinate. Now, what usually happens in a UTI, or urinary tract infection, is bacteria actually make their way into the urethra, and they go up the urethra into the bladder. Usually we have urine in the bladder being stored, and this bacteria are going to grow, multiply, and proliferate inside of this urine. When we have this excessive growth of bacteria in the bladder, we have irritation of the bladder wall. This is an infection. When this infection is localized just to the bladder, it's called cystitis. Now, the symptoms of cystitis are usually suprapubic pain and tenderness, urgency, which means the person feels like they have to urinate often, frequency, when the person actually does urinate often, and even hesitancy, where it's difficult to urinate. Dysuria is another common symptom, which is pain with urination. And of course, with any infection, we could have fever. Now, the issue with UTIs is that they could have many complications that could make them dangerous. In men, the prostate is located right around the urethra, which means men can have prostatitis from their UTI. In men and women, this bacterial infection could ascend up the ureters and make their way into the kidneys. This is called pyelonephritis, and it's very dangerous. The kidneys are a really important life-sustaining organ, and on top of that, they have a very large blood supply. Therefore, the bacteria can then make its way into the blood. That's called sepsis. Now, these are really dangerous sequelae of UTIs, and what we want to do is just kill the bacteria right when it's in the bladder in the first place. The two most common types of bacteria that cause UTIs are E. coli and Staph saprophyticus. These bacteria can be treated with really common antibiotics, such as nitrofurantoin, trimethoprim sulfonamides, ampicillin, and cephalosporins. Remember that this TMP-SMX cannot be used during pregnancy because it could lead to neural tube defects. Now, UTIs are very common, and they're actually more common in women than in men because the urethra is much shorter in women than men. Therefore, it's very easy for bacteria to make its way into the bladder. Now, if you have any questions, drop them down below. We're happy to answer them.